I'm your nurse today. How are you?
I'm doing alright.
My name's Molly.
Nice to meet you.
So before I came in here, I was looking over your chart, and I saw that you did not mark using alcohol or drugs. And I was wondering if I could ask you a few questions about that.
We're in a big hurry. Can we just do my physical and be done?
I'm really interested in your health and well-being, and it'll only take maybe 5 to 10 minutes, and everything's confidential in here, so don't be afraid to talk about any aspects of your health.
I guess we have 5 minutes.
Wonderful. Okay, so tell me about your typical day.
Well, I wake up, get ready, go to class, and then after class, I'll usually hang out with my friends for a while, eat dinner, do homework if I have time. But I've been really stressed out trying to balance friends and school, and I'm trying to get a new job, so.
Wow, it sounds like you have a lot going on. What do you and your friends usually do for fun?
Normally we just hang out and chill in my apartment. We sometimes go out to do things, but my friends just like to smoke weed.
Okay, so what do you do when your friends are smoking?
I usually just sit around and watch.
Come on, Morgan, tell her the truth. You know you don't just sit there.
Don't tell me what to do, Joe.
If you don't tell her, then I will. Your actions are hurting this relationship and your future. It's fine, I'll leave. Just tell her the truth.
I ask all my patients these questions, so don't feel uncomfortable. Just, if you don't mind, just speak the truth, and it'd be more beneficial for your health. And whatever you say in this room is confidential unless I feel that you're at harm or that you're at risk that you might hurt somebody else.
Okay, I'll give you the truth. I'm not going to hide it anymore.
In the past year, have you had 4 or more drinks in a day or more than 7 in a week? And by alcohol, I mean beer, a glass of wine, 12 ounces of beer, a glass of wine, and 1 to 1.5 ounces of liquor.
I drink occasionally when I go out with my friends on the weekends, but never more than a couple of drinks. I don't really like getting drunk and feeling hungover the next day.
So in the past year, have you ever drank more than you meant to?
No, drinking's not really my thing. I have too many responsibilities, and drinking can get in the way of them.
In the past year, have you ever used tobacco, pot, or prescription drugs that were not for medical reasons?
I really don't feel like it's that big of a deal, but I like to smoke pot with my friends, and it helps me release stress from school.
So let me get this straight. You like to smoke pot in order to relieve stress from school?
Yeah, I guess you could say that.
Considering what you told me about your drug use, this puts you at moderate risk for substance abuse. From the encounter with your boyfriend, it seems like weed is actually having more negative effects on your relationships rather than relieving the stress.
I really don't feel like it's that big of a problem. I only smoke like once or twice a week, and it just makes me feel better.
In what ways does it make you feel better?
I don't know. It makes me feel more relaxed and helps me take my mind off everyday issues. It also helps me to forget about all the stress I've been feeling with school. And it also helps me relate to my friends because they all do it all the time, so it makes me feel like I fit in.
Okay, so you feel more relaxed when you smoke and more comfortable around your friends. Do you know any negative effects of smoking?
I guess there are some negative effects. It makes me feel really tired sometimes, and I feel like I can't get anything done. I haven't been very productive at all lately. I'm really falling behind in my schoolwork, and even my teachers are starting to notice. I've been spending a lot of money on it, and obviously my boyfriend has been really upset about it, so it's bringing a lot of tension, and he's always trying to get me to quit.
Okay, it sounds like there's more negative effects than positive, and I'm so glad that you recognize these negative effects. It is your life, ultimately, and you made decisions for your health. But I was wondering if you think back at a time or an example of when you didn't have to deal with these problems.
Well, I guess it was like a couple of years ago before I started smoking. I was really involved in a lot of different things. I did school stuff, hung out with my friends a lot. I even used to go to church all the time and hang out with kids in my youth group. and I swam for my high school's varsity swim team. So that was a lot of fun, and it kept me really busy. I didn't really have time for anything else, and I actually do miss doing these things.
So you say you miss these things, but you're uncertain about removing yourself from your friendships. What do you think you'd have to do to get back to that other lifestyle?
Well, I would definitely probably have to stop smoking and most likely stop hanging out with a lot of the people I put myself around.
No, I think that's a really good idea. Have you ever considered cutting back?
Not really. I didn't think it was a problem before, and I enjoyed it.
Well, it seems that you want to get back to going to church and swimming. Is this correct?
Yeah, I can really see how much it's affecting my life now.
Now that you know the negative effects of smoking marijuana, on a scale of 1 to 10, how ready are you to cut back?
I don't know. Maybe like a 3. I mean, I just came in to get a physical one. I didn't think I would be considering changing my lifestyle or my habits.
Okay, so you said a 3. How come you didn't say a 1 or a 2?
Well, I never really thought of the negative consequences until you asked about them. And it does cause relationship problems. I'm less productive, and I spend way too much money on it. I didn't think it was really having that big of an impact on my life.
I can really see how your academics and your relationship mean so much to you, and I'm so glad that now you see how smoking is actually impacting those things negatively. Can you tell me what you value, and if you continue smoking, how these values will be affected?
Well, the relationships in my life are really important to me, way more important than smoking. Joe really wants me to quit, and I think quitting would honestly get rid of a lot of our problems. Plus, I really don't want to lose him over something as stupid as smoking. And also, my grades are really important to me as well, and if I don't keep them up, my parents will make me come home. So, pretty much overall, if I continue smoking, it'll affect my relationship, my grades, and my future.
I understand that you care so much about school and your relationships, and you wouldn't want to jeopardize losing those things. What do you think that you could do to better help your future?
Well, I could start off by not hanging out with that group of friends, but I think that would be kind of hard because I've been friends with them for so long.
Yeah, I can see how difficult that would be. Maybe you can just hang out with them less to start out with, and I'm sure that your boyfriend Joe would help you a lot. He seems to care and to be very supportive.
Yeah, he does care a lot, and I think he would definitely help me, which he's been trying to do for a while.
So did you have anything else in mind? Maybe you could think about the activities that you used to do before you started smoking marijuana.
Yeah, I could go back to church and hang out with some of my old friends there. I think that would be really good for me. And I could see if there's an intramural swim team at my college. I would really like to do these things again, and I'm sure Joe would help me and go with me to church, and I feel like it'd be really easy to join a swim team there.
Wow, these are excellent steps towards change and bettering the future, and I think you definitely realize the negative effects of smoking marijuana, and you come up with alternatives to fill your time. I think that it'd be a good idea to write down your goals, so then you have it as a visual of what you're actually working towards.
Yeah, that seems like it would be helpful.
Some goals that you could write down are, going to church once a week, or going to a college group that meets at your church, and or just giving up a little bit more hangout time with the friends that smoke, and but make sure that your goals are attainable and that they're realistic, and actually put down goals that you think you can meet.
Okay, well, I think there's a college group that meets every Wednesday, and there I can make new friends and slowly stop hanging out with my old friends, so that can be something. I can reduce my smoking to once a week, and that way I can hopefully eventually quit. And next week I'll go to school and sign up for the intramural swim team.
those are very great, reasonable goals, and I definitely think that you can obtain those. I definitely want to see you again in maybe a month for a follow-up appointment. I just want to see how far you've come. And I think that we can finally get on with our physical.